Fox 13 is teaming up with IASIS Healthcare, and we are talking about stroke today and how we can prevent stroke. Folks, if you have a question regarding stroke or high blood pressure, you can call our phone bank, 1-844-744-3258. And we are joined now by Dr. Ryan McDonald of Davis Healthcare Medical Center. Thanks for joining us.
Hi, thank you. Great to be here.
I guess some 800,000 people suffer strokes each year, and 75 million people have high blood pressure. Is that about right?
That's about right. Yeah, that's correct. The scary thing about stroke is it can be one of those silent killers. One of the main problems with stroke is the high blood pressure. So the high blood pressure, you think about that as just a high pressure system that's constantly inside your vessel. It's constantly pressing up against those vessels, and when your heart's pumping at that high rate, it can cause more damage and occur. And what can happen is you can actually have a bursting of that blood vessel or a blood clot of that vessel.
So obviously folks want to keep their blood pressure down. It's a great prevention when it comes to stroke. How can people do that?
Good question. So we've been getting lots of calls in today about how to just do that. The most important things that you can do at home without going to see your doctor would be your diet. Your diet is essential in this, and there's a big controversy about salt, what to do with that. If you are at risk for high blood pressure, the salt will play a factor in that. Other things is staying away from the fast food, the processed food, sticking more with your fresh vegetables and your fresh fruits, and drinking more water. I mean, a lot of people in Utah, I think, are real heavy into the Diet Coke. We've had a lot of calls about that. So 2 liters of Diet Coke a day, not good. 1 can a day, reasonable. That's not too bad.
Okay, so we see a list of things for reducing stroke, steps people can take, and there they are. And a lot of those are common sense. There are also some checks that people can go through if they have regularly had high blood pressure to kind of scan for their risk of stroke, are there not?
Exactly. So one of the main ones on there was smoking. The most important thing a person can do is stop their smoking. If they can get that out of their life, then the blood pressure will come down. Their risk of cardiovascular disease, the strokes and heart attacks will definitely come down as well. Keeping yourself healthy with some exercise every day is another fantastic thing. Limiting your stress, if we can all do that, that would be great, right? But that's a little bit hard thing to do. Other things is that once you've done all those things at home that you can really do, monitoring your own blood pressure, making sure if it is still high, going to see your doctor, because we can get you on medications that will get that blood pressure down to a level where you're not at risk for having a stroke and heart attack.
Very good. Dr. Ryan McDonald, thank you very much for being here. Thanks to all our volunteers for being here. Folks, if you do have a question, you're concerned at all about high blood pressure or stroke, please call the number on your screen. It's 1-844-744-3258. Thanks to the folks at IASIS Healthcare as well. Nineveh.